Hi, I'm Dr. Dane. Welcome to the Naples Brain Center Parkinson series. I created this series to answer the top 10 questions commonly searched online about Parkinson's disease. I've had over a decade of experience working with individuals diagnosed with Parkinson's. I've seen so many great successes. The Naples Brain Center was established after transitioning from the Carolina Brain Center when I returned to my hometown of Naples, Florida. I hope you find this series informative. If you're looking to learn more quickly, I've answered all of these questions in a 15-minute presentation available on the website, naplesbraincenter.com. We're going to talk about the stages of Parkinson's disease. Parkinson's progresses through 5 stages, from mild symptoms like slight tremors to severe disability affecting mobility and daily life. While each stage brings its unique challenges, early intervention can make a huge difference. If you've tuned into previous videos, you'll know that there's a premotor phase of Parkinson's disease. It's often referred to as the prodromal phase. This precedes the onset of classic motor symptoms and is characterized by non-motor symptoms such as a reduced sense of smell, REM sleep behavior disorder, constipation, and mood disturbances like depression or anxiety. These symptoms, driven by early alpha-synuclein pathology and non-dopaminergic systems, include the olfactory bulb, which has to do with the sense of smell, and the enteric nervous system, which has to do with digestion. And it can appear decades before motor manifestations. This offers a critical window for early diagnosis and potential neuroprotective interventions. Stage 1 is the earliest stage of Parkinson's disease, and the symptoms are mild and typically affect only one side of the body, such as a slight tremor in the hand or a reduced arm swing while walking. Patients can usually manage daily activities without significant interference, but early diagnosis and intervention can help slow progression. As Parkinson's advances to stage 2, symptoms become bilateral, involving both sides of the body with increased tremor, rigidity, and bradykinesia that may slow movements and affect posture. While balance remains intact, daily tasks like dressing or eating take longer and speech may soften, prompting the need for tailored therapies to maintain independence. Stage 3 marks the mid-stage of Parkinson's, where loss of balance and postural instability become evident, leading to falls and noticeable slowing of movements. Although patients can still live independently, they often require assistance with complex activities, and medications like levodopa are typically optimized to manage symptoms effectively. In stage 4, severe disability sets in, with significant rigidity and bradykinesia making walking difficult and requiring a walker or a cane for mobility. Patients can no longer live alone safely and benefit from multidisciplinary care, including physical therapy, to preserve as much function as possible despite the inability to perform many daily tasks unaided. The final stage of Parkinson's disease confines a patient to a wheelchair or bed due to profound stiffness, bradykinesia, and instability. This renders them dependent on caregivers for all activities of daily living. The focus at this point shifts to palliative care, managing complications like swallowing difficulties or infections, and ensuring quality of life through supportive measures. Getting an early start with our targeted strategies is excellent, but don't not act if you're in the later stages. Your brain retains the ability to adapt and reorganize throughout life through a process called neuroplasticity. In Parkinson's disease, where neuronal loss occurs, the remaining neurons can form stronger connections to partially compensate for functional deficits. My approach for Parkinson's patients integrates targeted therapies, including physical, occupational, and cognitive interventions designed to harness neuroplasticity to optimize movement, enhance postural stability and balance, and promote greater independence. Rest assured, at Naples Brain Center, I understand the complexity of Parkinson's and how it affects you and your family. Don't let Parkinson's define you or your loved ones. Visit NaplesBrainCenter.com to learn how our personalized and cutting-edge therapies can help. You can schedule your free phone consultation today and take your first step toward reclaiming control. Up next, what treatments are available for Parkinson's?